Hello, my name is Dalia Elkazaz. I am a senior global and community health major here at George Mason University. This is a slideshow about the topic of precision and predictive modeling. This presentation was prepared as a part of the HAP 360 course on information systems and healthcare management taught by Dr. Farouk Almi at George Mason University, Department of Health Administration and Policy. This assignment focuses primarily on precision medicine, and when we go deeper into what precision medicine is, it is a medical model that proposes the customization of healthcare with medical decisions, treatments, practices, or products being tailored to the individual patient. The first step is to create a table showing the relationship between anxiety diagnosis and response to citalopram, and we're going to report the success rate among patients with generalized anxiety depression. If we look on Blackboard under the assignment tab, we can find the file which we will use to retrieve the data to complete this assignment. Once we open the file, we will go ahead and select all the data. On the top left corner of the Excel spreadsheet, you will see a gray triangle. Once you click it, it'll turn green, and that means that you will have selected all the data. Once all the data is selected, click the Insert tab at the top and then choose the Pivot Table option. Once we have done that, the screen will change to look like this one. We will go to the Pivot Table field and select Generalized Anxiety Disorder. Go ahead and put a check in that box. It'll move down to values first, and then we're going to drag it over so that it ends up in rows. Then we are going to select the CIT success, move it from the values box to columns. But we do also want it in values, so drag it back there as well. So now we have generalized anxiety in rows, CIT in columns, and in values. Click on the miniature eye in the top right-hand corner of the values box and choose the count option. Once we've done that, this is the chart that you should end up with. In order to find the rate of success, we need to go ahead and divide the success by the grand total. As you can see, that is 117 divided by 366, and we then end up with 0.32 as the rate of success for citalopram among patients with generalized anxiety depression. The second step of this assignment is to determine which medication has the highest success rate when the patient has an anxiety diagnosis. Find the rate of success for each of the medications. In order to do that, we're going to duplicate the process we just used for citalopram with the other medications in the file. Once we've done that, we can compare the success rates of all the medications. The next part of the assignment asks us to consider why it is so difficult to figure out which medications actually work for the patients with generalized anxiety disorder. And when it comes to things such as generalized anxiety, patients tend to self-rate their symptoms and self-report, and that may lead to variability among patients and what works for them, as well as external factors that may cause depression or may be an underlying factor of it. The next step, or step 3, would be to find which medication has the highest rate of success when patients have substance abuse. So in order to do that, we're going to replace a generalized anxiety diagnosis in our process with drug abuse diagnosis and repeat the process for each of the medications. Here are the drug abuse diagnosis rates of success laid side by side in a chart so that we can compare and it seems that BP success rates are the highest for patients that are diagnosed with drug abuse. That is the end of the assignment, and it is all complete. Thank you. The objective of this assignment is to analyze response to treatment.